South Africa's private and public hospitals are facing an onslaught of challenges, making it harder to care for patients. These include the decaying infrastructure and the impact of vandalism and theft in hospitals. To discuss this further, we're joined by the Treatment Action Campaign National Chairperson Sibongile Tshabalala, who joins us virtually. Sibongile, thank you so much for your time. I think you'd agree that our hospitals have very much become almost the front line of the rapidly decaying infrastructure in our country. And because we're seeing this in real time, it's having a very real day-to-day effect on people's lives. And indeed, as we saw when that letter was written by Dr. at the Rima Musa Hospital not so long ago, it's having an impact on who lives and who dies. As we continue our focus on infrastructure in the country, if I had to ask you what you believe the report card should say on the state of our hospitals, what would your grade be?
Thank you for having me, and good afternoon to everyone. You know, the state of our hospital, it is said that it's only now that other people are start talking about it and writing about it. If you remember, it's something that Treatment Action Campaign and its partners, we've been talking about this issue for quite some time. Up to a such when last year Treatment Action Campaign spent 2 nights outside the Premier of Gauteng office calling for infrastructure to be being in order, and also talking about issues of Charlotte Maxeke, since we know that Charlotte Maxeke was burnt down. We know there's been incidents at Helen Joseph. Rahima Musa was one of the hospitals that were also affected badly. When we did our monitoring, what we found out is that hospital, it's at the verge of being in the same situation that Charlotte Maxeke was in. So the issue of infrastructure, it's a very serious matter, and it's an urgent matter that needs to be taken into care. But then the problem is that we don't have people who are listening, or the government that listens when people on the ground are talking.
What are we dealing with here? Because the information and the data on the crisis that our hospitals find themselves in, the information is there. We know where the issues are. We know what the priority should be, and what should be at the top of the list of what's being fixed. And it seems to be a cocktail. We're focusing on vandalism and theft and that impact. But then you add to that issues around service delivery, around running water, blackouts as a result of Eskom not being able to keep the lights on. Are we just dealing with a dereliction of duty from the government departments whose responsibility it is to keep the lights on, to keep the water running, and to ensure that these hospitals are maintained in the way that they should?
Here we are dealing with the corrupt government. We are dealing with the government that is ignorant, that doesn't listen to people, the government that doesn't even take care of its people. They only know people when they need people to vote. Only 5 years when they want votes, they will come and promise people all these things. They will respond to the issues on the ground, but after that, they just forget about it and fight amongst themselves. So it's not the matter of we don't have resources to fix this, and we don't have departments that needs to work on these issues. But the challenge that we have is the corruption that is happening within the government department, within the Department of Health, within the Department of Infrastructure. We heard in the earlier this year where most of the officials were suspended at the Department of Infrastructure in Gauteng, to show that people who are working for government and the government itself, they don't take obligation that they've signed up for, to say they will protect the state, they will protect people of this country. And what we are talking about, as we have been saying, that a healthcare system is in crisis. Now it's not in crisis. It has collapsed, and it's collapsing every day. And most of this, what worries us mostly is that people who suffer most are the people on the ground.
Indeed, and like you rightly point out, your organization or one of the organizations that's been able to keep a spotlight on this, and not just every time there seems to be a story focusing on a crisis of some sort, but one of those crises were, and you mentioned it, at Charlotte Maxeke Hospital. We had the fire there, but that also lifted the lid on the very serious issue of theft and vandalism at that hospital. Security was an issue, and of course then we found out more about how contracts and tender processes weren't being adhered to as well, and that's a completely different kettle of fish, but as serious an issue as well. Talk to me a little bit about how serious the issues are at Charlotte Maxeke Hospital, just as an example of what so many of our hospitals are facing today.
You know, when we talk about Charlotte Maxeke, I always feel hurt because most people are dying unnecessarily, and we've been trying to engage the Department of Health at the national level and at the provincial level about this issue. And what hurts me mostly is that we've been given promises that they are working on the issues, but instead of working on the issues, they keep delaying the process there of opening that hospital and maintain and fixing what the infrastructure of Charlotte Maxeke. Now we are told that the hospital will only be finished at December 2023. The question that everyone should ask themselves: Charlotte Maxeke is one of the hospitals that provide services on oncology, and in South Africa we have an oncology crisis. So it means most people who are diagnosed with cancer have been on the waiting list for a long time. Now the situation has doubled. Most of people are dying because they can't access proper medication, and there is no accountability. That is so bad from the government that is leading us. There is no accountability. They are taking us from pillar to post. They are always blaming other people, but when you say let's sit around the table, all partners, stakeholders, so that we find a common solution, it's hard also to do that, which it's also problematic. So the problem with Charlotte Maxeke, you know, I think it's a national crisis. It's not just a provincial crisis, but we don't get also the responsibility from the government to say this is how things should be done, and how do we fast track the issues of Charlotte Maxeke. We are not saying they should just fast track and give us poor services, but we say they should do a proper maintenance of that hospital, and making sure that that hospital is functional, so that people of South Africa, because it doesn't only cater for people from Gauteng, but all other provinces, especially on the services of oncology. So we need that hospital as in yesterday, but we always find delays because people are still looking at tenders to say who are they giving tenders, how are they going to get some change out of that, how are they going to get their friends to get tenders to fix that hospital, that is not the case with us. What we only want is the hospital to keep on running, and they need to fulfill the right of the people on the ground and make sure that people are accessing medication as they are supposed to, or services, healthcare services as they are supposed to.